Good afternoon, and thanks so much for joining us for this, our first COVID-19 press briefing of the week. Today, Orange County Mayor Jerry O. Demings will discuss our goals for the week, which we do every Monday, including encouraging residents to go out and get vaccinated. The mayor will also provide details on the mobile vaccination sites and age requirements for the vaccine. There will be an update on our COVID-19 numbers and details on the mask mandate. Orlando Mayor Buddy Dyer could not be here with us. However, Alvina Chu from the Department of Health in Orange County is here to discuss details on the vaccination process as well as COVID-19 trending in our area. We'll begin with the mayor. Mayor?
All right, good afternoon to all of you. We'll start the press briefing this week with kind of the backdrop of the fact that just yesterday our nation reached a pinnacle in which we passed an important milestone. At least half of the adults in our country have been partially vaccinated against COVID-19. As of today, the presidential mandate is that the vaccine must be made available to all adult Americans. And we are all working towards getting to that point of herd immunity. Of course, that is somewhere around 79 to 80% of our population. In Orange County, however, we have 53.5% of our residents age 40 and older who've had at least one shot of the vaccine. Overall, 29.73%, or almost 30% of all of Orange County residents are partially or completely vaccinated. So we still have a ways to go to get up to that 79%. So our goal this week is to get the shot in as many arms of our residents as we possibly can, striving to reach that goal of 79 or 80%. Number two, to continue to offer free and convenient appointments at the convention center and through our mobile site, which is at the Silver Star Gym this week. And number three, we will continue to offer free testing to all residents so that we can ensure that they know their status as we endeavor to slow the spread of the virus within our community. Since our top goal this week is to get more of the vaccine into the arms of Orange County residents, there are plenty of chances to do so. On Friday, 17,000 appointments for this week opened at the Orange County Convention Center, and we have roughly 11,000 appointments left. So if you want to get vaccinated at the convention center, you have ample opportunity this week. That means that if you go to that website now, you should have the opportunity to get vaccinated. Unless you are under the age of 16, there really is no reason not to get a free shot. The convention center is fast and convenient, and you do not have to get out of your vehicle. We have perfected the process at the Orange County Convention Center. The Florida Department of Health in Orange County has indicated that there are more than 120 vaccination sites available in Orange County alone. So if you want information about where you can get vaccinated, all you have to do is you can go to our website at ocfl.net/vaccine. And all of our media partners also have the various links to the different vaccination sites available. We have more than 750 vaccination appointments booked for today at the Silver Star Park Gymnasium as part of our mobile efforts to combat COVID-19. And you can see, I think the picture behind me will come up shortly. But there are still plenty of appointments available for Tuesday, Wednesday, or Thursday of this week. Remember that walk-ups will be accommodated on Friday. The site offers appointments between 9 a.m. to 6 p.m. this week, and walk-ups are open on Friday beginning at 9 a.m. The Pfizer vaccine is to be given at this location and available for those, again, 16 and older. Please remember, however, if you're 16 or 17, you must have your parent or guardian present at the time of the vaccination. Last week, I mentioned that I was considering loosening the mask mandate with a phased approach? Well, we are continuing to evaluate data and develop our plan. There are three things that happened within the last few days that we have to take into consideration now. One, unfortunately, our numbers are headed in the wrong direction. In mid-March, our 14-day positivity rate was around 5%. Today, it has inched up again to 7.6%. The last time it was that high was February 11th, when the positivity rate was 7.7%. So in the last 2 months, we have continued to see now our positivity rate go up. The second thing that happened within the last week, Johnson & Johnson was taken offline or paused, and we may be experiencing now a slowdown in the pace or rate of vaccinations within our county. And number three, hospitalizations are increasing slightly. So those dynamics have caused us to reevaluate our phasing methodology. I will be meeting with medical professionals this week to discuss the mask mandate and what phasing processes should be given the current dynamics. But we need everyone to do their part and get the vaccine so we have at least 50% of our total population inoculated before we can really move to any significant relaxing of our mask mandate. Again, right now, we are just under 30%, so we have another 20% or so to go. Since the start of the pandemic, there have been a reported 132,000 cases here within Orange County of COVID-19. 1,228 residents have died from the novel coronavirus in our community. That's a number that we really hate to focus on, but yet it is the reality of just how deadly the virus can be. Barnett Park remains open 7 days a week for free coronavirus testing. They offer rapid or antigen testing or PCR tests. As of tomorrow, the FEMA site at Valencia's West Campus will again offer first doses of Pfizer. This site, again, is walk-up only. No appointments are necessary. Currently, the location is slated to close Wednesday, May the 26th. More than 200 COVID-19 vaccinations were administered to our inmate population last Friday. The COVID-19 vaccine was given to those inmates with medical vulnerabilities and those who are part of our work release program. This voluntary vaccination program is offered to our inmates, and the program will continue. In fact, there are another 450 inmates who recently expressed an interest in being vaccinated. Orange County Corrections, along with Health Services, plans to vaccinate those inmates on Thursday of this week. Thank you to our health personnel who are helping to vaccinate all residents of our community so that everyone has access to the COVID-19 vaccine. And let me talk a little bit about our campaign, I Got My Shot. For those of us who have already received our COVID-19 shots, I would urge you to share your experience on social media, like hundreds of our residents are already doing, as part of the I Got My Shot campaign. Again, there should be some photos up behind me. Our goal is simple. We want to advocate for people to get the vaccine. Everyone has reasons for wanting to get vaccinated. Some want to protect their family and friends. Some want to protect themselves. Some want to travel. Some want to return to work or school. So I simply ask all of you, what's your reason for wanting to get vaccinated? What is your reason? I know you want to get vaccinated. And so now let me just turn it over to Alvina Chu. I almost said Dr. Alvina Chu, but she's a doctor in the making, but she's an epidemiologist for the Florida Department of Health. Ms. Chu.
Thank you, Mayor Jennings. As the mayor had mentioned previously, as of today, we've had 132,053 positive cases of COVID-19 reported to us. Our current recovery rate remains at 96%. Our 14-day rolling percent positivity rate is up to 7.6%, and this is positive based on positive and negative PCR lab results. Unfortunately, we've had a total of 1,228 COVID-19 related deaths as of today. And this is 11 additional COVID-19 deaths reported to us since the last time we spoke. To the families and friends, we want to express our condolences. The age ranges for these recent deaths were 42 to 93 years old, with a median age of 69 years. 6 were female, 5 were male. 1 was Asian, 4 were black, 6 were white, 2 were Hispanic, and 9 were non-Hispanic. 7 had known underlying health conditions, and 4 had no known underlying health conditions. 1 date of death was from January 2021, and this is after third-level review at Tallahassee for these cases, and 10 dates of death are from April. 1 of the 11, or 9%, were reported from a long-term care facility address. And just as a note, this percentage has been going down, I think, especially because of the high percentage or proportion of persons in long-term care and those 65 plus that we've been able to vaccinate. And so this is really encouraging as our hospitalizations and deaths significantly decreased in the oldest and most vulnerable segments of our population. As of April 18th, we've had a total of 234 cases of the variants reported to us of the B117 type that was first identified in the United Kingdom. Since last time we spoke, there were 51 new cases of this B117 variant. We've had 4 additional other variants reported to us. 2 were the B1427. 1 was the B1429. These 2 variants were first reported in California, identified last spring. No new B1351 cases, and 1 P1 variant case that was first identified in travelers from Brazil. So the total age range, the age range for all of the cases that we've had reported to us now is 5 to 84 years, with a median age of 34 years. 3 had a known hospitalization, 100 had no known hospitalization. 5 had known travel, and 102 had no known travel. As Mayor mentioned, we've got plenty of appointments available this week at our Orange County Convention Center vaccination site. You can visit CDR Health Pro website at www.patientportalfl.com to create your account and schedule an appointment. And just to let you all know, as the Mayor mentioned, that we are providing the Pfizer vaccine at the Convention Center. So 16 and 17-year-olds can get vaccinated at the Convention Center. Their parents and guardians must accompany them and when they get their vaccine. This Thursday, April 22nd, will mark our 100th day vaccinating the community at the Orange County Convention Center. And on behalf of the department, we'd like to thank all of our staff and community partners. I'd like to note that after you get your second dose of vaccine in a 2-dose series, or after you get your single dose of a single-dose series of vaccine, that the immunity takes a little bit of time to build, and so we recommend that you are still susceptible, potentially susceptible, to infection up to 2 weeks after your last dose. And so we'd like to remind you to continue to practice the good pandemic precautions, such as wearing your mask, watching your distance, and washing your hands until at least those 2 weeks have passed. And, you know, with the vaccines, we know are exceptionally good at protecting us against severe hospitalizations and death, and are still being evaluated for their effectiveness for preventing transmission. So we'd still like you to continue those pandemic precautions after that, but we'd like to let you know, after you get the first shot, it's not like, boom, you're ready to go. So please continue to be cautious after you get your second dose, and we know that you'll be protected, very well protected after those 2 weeks after your last dose. So total doses administered as of April 18th was 714,469. Residents receiving at least one or more dose of vaccine is 420,837, and as the mayor mentioned, it's 29.73%, or nearly 30%. And we're really encouraged by the high proportion of vaccination rate in our 65-plus population. So 126,512 doses, 126,512 residents 65 plus have received one or more dose of vaccine, and this is almost 80%, so 78.42%. So I'd be happy to take any questions, and I'll turn it over back to Mayor Demings.
All right, thank you, Ms. Chu. We do have backup today. I see Commissioner Nicole Wilson has joined us, and Commissioner Maribel Gomez-Cordero. They can help with the Spanish translation, and we also have Ms. Ilia Torres, my special assistant, who's here today. We have Mr. Scott Howard from the Orange County Public Schools, who's here, and as always, Tim Bodick is there in the back, and he can talk about any compliance team efforts. And we have other staff members here should there be some other questions that will come up. So we'll open it up for questions at this time.
Lauren Seabrook, Channel 9. Mayor, my question's for you. When you talk about now that we have, I think you said 120 vaccination sites around Orange County, I guess it makes sense that the doses would be spread out and maybe you wouldn't see as high numbers at places like the convention center. But it does seem a little concerning that we have so many appointments available. Are you worried that we could be nearing a point where there's just not much demand for the vaccinations? I mean, I know you guys are doing the campaign, but I just wonder, are there incentives that could be, out in the community to try to get more people vaccinated? What are your thoughts on it?
I'm not sure what has caused the apparent slowdown in the rate of people signing up to get vaccinated, but we're going to do everything that we can to encourage people to get vaccinated. That's why we have done the I Got My Shot campaign. But also, even though there are multiple locations, obviously with 120 sites throughout the county, most of them are not designed to do high volume. They're only designed to do 100 or 200 a day, if that. But the convention center is a very, very efficient operation. Now that we are nearing nearly 100 days of operating there, the staff has really perfected the process, so we can get thousands of people through that site on a daily basis. And suffice it to also say that even the FEMA site, fairly efficient site, they can get many people through there. So there's no shortage at this time of supply or inventory. We just have to get the demand up. So one of the strategies that we are using is to try to make it more convenient for our residents to get vaccinated. And that's why we're using the mobile sites. We're going right into neighborhoods and communities. At the last press briefing, we announced to you that the state was pretty much taking control of the homebound initiative, where individuals could sign up to actually get the vaccine right in their home. So if you are one of those high-risk individuals and you want to get inoculated right in your home, you can sign up through the state's website. So by doing all of this, we hope to take away any of the things that may inhibit individuals from getting vaccinated. And we are seeing more people who are helping to become advocates by sharing their own personal experiences during a period of time where we do see some individuals who still challenge the efficacy of the wisdom of vaccinating human beings. But that's a small group within our community that unfortunately they believe what they believe. But our goal is to still get up to that 79% of our population. And I believe that we can get there. So we still have a ways to go. But through the support of our local media, you share the stories, and in my estimate, your journalism has been fair, over the period of time when we have endeavored to manage this process going forward. Again, the president has said that he wants all adult Americans, as of today, to have access. So that means providing the inventory. And they're saying that Florida and the counties within Florida will get substantial increases even since there's been a pause of the Johnson & Johnson. So don't know when that will come back online, if it will come back online, but the federal government is saying they have ample supply to meet the demand.
Okay, this is Melissa Thomas with Florida National News. This question is for Ms. Alvina Chu. Wanted to get your thoughts on, obviously Dr. Fauci had been talking about the eventual need for booster shots. So just wanted to get your thoughts on that, especially here at the local level, particularly given the numbers you just shared with us in terms of the variants that are currently in Orange County.
So I think we've had these discussions before about how the variants, mutations occur. So, an infection, a person who's infected can create 10 million viral copies. And so every time there's a copy, there's this potential that there is going to be some misreading and some mutation. And as I mentioned, some mutations mean something and some mutations don't mean anything at all. So what we're hoping for is to increase the vaccinations to reduce the number of infections. Mutations will continue to occur as long as the virus is able to infect others here or around the world. And so as those mutations happen, perhaps and likely further down the road, we don't know how far down the road that is there may be a point where the vaccines are built towards the current virus, but may have some reduced effectiveness against a future virus. And so I think that's what we're pre-planning ahead based on what we know about viruses and how they reproduce and mutate.
This is Nikki Zizaza with News 6. This question is for Mayor Demings. So Mayor Demings, the mask mandate has been top of mind, and what I would like to know is it a combination of the factors that you mentioned that is causing the county to scale back in the timeline to kind of relax the mask mandate, or could we see that in a couple of weeks, maybe if, J&J is made available again, or just some of the factors? Is this a combination of everything in terms of the positivity rate going up, or if, maybe two out of the three that you mentioned happen, then we could?
Yes, it's a combination of those things that I mentioned. The fact that we are seeing a slight uptick in the numbers of new cases within our community. Some average 300 plus new cases every day. Taking into consideration the fact that there was a pause in the Johnson & Johnson availability within our community. And the last thing that we took into consideration was the fact that hospitalizations are edging up slightly as well. I had a conference call last Friday with the major hospitals here within the area, and they all were reporting slight increases. They were not at the level where they were very concerned about it, but they're monitoring it. And so given all of that, we have to seriously take a look at what that phasing will look like. There's been some research that has been done by the University of Central Florida and some of the faculty researchers there that we're going to study, and then we will work with the Department of Health to develop a reasonable phasing. I think even with the phasing, it's going to likely be several months before you can see any significant reduction in the wearing of facial coverings. I think what you may see sooner than later perhaps is the reduction of the social distancing requirements. We may be able to do that in a phase of the continuation of the reopening of businesses here within Orange County. So all of that is something that I'm taking into consideration. We have to base those decisions going forward on the data and the science behind it. But suffice it to say that sometime probably summertime mid to late summer, we should see where we are able to really relax the facial coverings. That's the course that I believe that we're on at this point. If something happens between now and then that causes us to reevaluate the timeline, then we have to do the responsible thing to keep our citizens safe. We wouldn't say that we're going to do away with facial coverings at a time when the virus is spreading rapidly in our community, for example. We wouldn't do that. The fact that we are also seeing a slight slowdown in the rate or the pace of vaccination concerns me, because, again, the more people we have vaccinated, the less likely the experts will say we need to continue wearing the facial covering. So we need to get closer to that 79%, I think. 50 to 79%, we should be at a better place than we are today. So it makes a good, I think, business sense and public safety sense for us to be able to do that going forward. So right timing, it has to be the right time. And I have commissioned a number of individuals to give us advice in that regard. Okay.
All right. Matt Lapoli from West 2. My questions for Ms. Chu. If you could, can we talk about how the virus is spreading now in terms of age group and transmission? And then secondarily, could you elaborate on what you said about the vaccinations effect on the older set of our population?
Sure. So currently the age group that contributes the most or the highest proportion of cases every day remains in the 15 to 34 range. And so we know, and this is the median age across the entire pandemic, we know has been approximately 33, with a slight increase in younger, or a slight decrease younger during the holiday season. So we know that this particular age group, are the ones that are sort of out and about and engaging in more behaviors that would lead towards an increase in transmission. So persons who perhaps they need to go to the workplace, like they're out and about more. Also, potentially in the skewing younger on that part of that age group is persons who engage in, say, riskier behaviors, such as gathering together in large groups indoors in spaces, and other like non-pandemic, not practicing pandemic precautions. So the other part of your question was about the effect that the vaccinations have had on the age group. So what Dr. Pino, I think maybe not last week, but the week before, had previously shown a really great graph to show that as the vaccine rate had increased in the 65 plus population, the rate of infections and of hospitalizations and deaths had a drastic downturn. And so we're hoping that we can reflect the same effect in the younger population. And so we're encouraging those who are in this age group who contribute the most to the spread during our Orange County cases can get vaccinated, so we can as well see the reflected decrease in cases, infections, and also in severe outcomes, hospitalizations and deaths.
Thank you. This next question comes in from Ryan Gillespie with Orlando Sentinel for Mayor Demings and Alvina. His question reads, given the 11,000 appointments open at the Orange County Convention Center, what effect, if any, do you think the pause on Johnson & Johnson has had on the demand for the other vaccines? Has it caused hesitancy across the board?
It's mere speculation on our part, but more than likely has had some effect on vaccine hesitancy. But that's my assumption.
We can only assume. The best we could do is try to get the good information out there that the remaining vaccines that we're still using right now are really great and effective at preventing severe hospitalization and death, and as I had mentioned, definitely contribute to a decrease in the spread of cases.
Thank you. This next question comes from Ryan Lynch with the Orlando Business Journal for Mayor Demings. Mayor Demings, what settings might we expect to be the first to be loosened for masks when the conditions are met?
I think outdoors, we likely will be able to reduce the distance requirements for people outdoors and perhaps even indoors. And then the final phase will be where we will not have any type of mask mandate. And that will come, I believe, when we get closer to the 50% of our total population that would have been inoculated.
Thank you. And this last one is for Scott Howitt with OCPS. This question comes from Steve Mort with WUCF Newsnight. His question reads, Scott, is OCPS planning to follow Commissioner Cochran's recommendation that districts make face masks voluntary?
So we're going to, I've obviously read his letter, and we're going to take that recommendation and guidance into consideration, as we will with all of our local health officials as we're making that determination for next year. Right now, we're going to look at and rely on the Department of Health, their guidance, as well as CDC guidance moving forward, but definitely take that into consideration. Thank you.
Okay, that looks like that's the last question. Just as a reminder, if we have Spanish-speaking media, take advantage of these Spanish-speaking representatives here today. And the next press briefing will be on this coming Thursday at 4:30 p.m. Thank you all for joining us today. Have a great week.